So first of all, I think that there are a number of key things to keep in mind when talking about new biotechnologies and this notion of regulation. I come from a world of regulation, I study regulation, and I tend to promote it, but I think that we need to really critically challenge that assumption that somehow regulation, and I do think it is used in this context a little bit as a quick fix. I think that the United States has been an anti-regulatory environment for years, as has other countries, and regulation is contextual, and it has to do with who's in power at certain periods of time and whose power and values and interests regulation serves. So one could argue that we have a lot of regulation in this country, but it doesn't serve the people that really maybe it should be serving. For example, I would argue the FDA is seriously broken. It does not serve the interests of the public in terms of safety and health. So I want to challenge that notion that somehow regulation is the answer. It may be the answer for some issues and context, but I also think we need to think a little bit more about what we mean by regulation. Another challenge that we face has to do with policy-driven bodies at all levels of government, not just the federal government. We tend to focus, again, this broad we, exclusively at the federal level. The state politics is very important, and much of the funding that affects us on a day-to-day basis is at the state level. So we need to look carefully at policy-driven bodies at all levels of government, including elite commissions, and ask whether or not they really are sufficient to ask and address the kinds of questions we're concerned about, and in fact, whether they reflect what some of us in political science still hold as an ideal in terms of democratic values, democratic decision-making, and democratic oversight. And not to be too critical of presidential commissions. I think they're important, and they're important for presidents, and they're important for the people who put them in place. But presidential commissions are elite bodies. They are not public forms of democratic governance. Despite the fact that Amy Gutmann is a fellow political scientist and made her career on democratic theories of communitarianism and democratic deliberation, it is not an entity at which the public has a role to play, even if it meets in public. So I want us to be really careful about pointing to these organizations as the places where we go to look for answers in discourse. It's not the place. It's a different place. I'm not quite sure where it is, but that's not it. Another point I want to make is that for many, many years, we've had fragmented and weak governmental oversight in this country. There was a notion one day in political science that Congress was an oversight body and that it oversaw the agencies that it funded. I would argue that doesn't happen. You can go to congressional hearings and see who shows up. It's usually the chair and the co-chair and a bunch of congressional aides. What does oversight mean? And the key oversight agencies probably are the funding agencies, not Harry Waxman and others who have an agenda to serve, but the people who are actually funding the NIH, the people who are funding other organizations that then fund and support research. So I think we need to look a little bit more carefully about what is oversight, what do we mean by oversight, and is it actually happening, both at the federal and the state levels? Another, I think, policy challenge has to do with critiques of funding, critiques of policies, without a real good evidence base for those critiques. And I say that in the spirit of it's important to raise the larger political, philosophical, and principled issues about stem cell research or genetic technologies. But I really do think that groups who are challenging these issues need to come up with better evidence-based analyses and evidence-based advocacy. And an example that I would use is some of the work that CGS and others have done in California, where they really tracked who is supporting stem cell research, who is paying for the lobbying, who is paying for the advertising, who is paying for campaign finance, who is supporting those legislators. That's all very granulated legislative analysis, policy analysis, looking at historical documents, looking at real-time documents. It takes a lot of work, it takes a lot of time, and it takes money. And those of us who get funding for our jobs can't get that kind of funding. So that's a challenge, I think, that we face in terms of the funding community. How can you do really fine-grained, deep policy analysis to follow the money, to follow the politics, to follow the power, not to point fingers, but to be able to say, this is how this piece of legislation got in place. This is how Congress actually addressed this issue. and funded it, or didn't fund it, or funded it in a certain way. This is basic public policy and legislative analysis and legal analysis that many of us do in silos, but it's not really put together in a way that I think can be useful for an advocacy strategy, and even not even an advocacy strategy, but just at least a public discussion strategy. So I think there needs to be some investigative detective work. And I think that's a real challenge for this and other activist communities. And then finally, I think that because we have a fragmented and weak government oversight system, there needs to be much more, as opposed to criticizing governmental agencies, actually paying attention to what they're saying, and as Sheila pointed out, what they're not saying. I think it's very critical that we do that. One other point that I think has been raised on many times about partnering, I admit I'm an academic. I bring that academic model to the world of discourse, but I think that partnering with other organizations and maybe grassroots organizing, I still remember having the little blue pamphlet that Saul Alinsky put out. I can't remember the name of it, but many of you are in this room are old enough to remember. You know, Sarah Palin is actually a really good example of grassroots organizing. We may not like the way she does it, and we may not like the outcome, but there really is a need to talk to people in communities. And I think that's a real challenge that those of us who work in elite organizations have to face. It's very, very hard to leave that world because we have certain obligations and commitments in that world, to really try to find a way to organize and talk at a level that people in our communities that we live in will understand, and to encourage not to talk to those communities, but to listen to what those communities are saying. And that's a part of what I'm arguing for in terms of evidence-based discussions and evidence-based strategies. I think it's a real challenge, and it's a challenge that I'm not quite sure I've overcome and figured out how to manage in my own life. But I do urge us to think about that more carefully.